Hi, are you dealing with shoulder pain? More specifically, shoulder pain that's on the front of your shoulder that seems to get worse when you're reaching overhead, maybe when you're reaching behind your back? I'm Dr. Gouveia here with HealthFit Chiropractic. Today we're going to dive into one of the most common shoulder presentations we see in the office. It's called subacromial impingement. This is just a fancy way of describing a pinching sensation that you feel in the front of your shoulder when you're reaching overhead. We're going to talk about the examination that you'd go through in the office and a couple stretches that not only you can do at home, but we will do here in the office as well. We'll show you what the treatment might look like if you are dealing with this type of shoulder injury. Here we're taking a conservative approach to subacromial impingement, and so we're ruling out any need for injections, potential surgery, and we might not even need to go for advanced imaging for these types of problems. So if this is something that you're interested in, we're going to show you in the following video how we're going to approach it here in the office and what you can expect when you come in to see us. When we're talking about subacromial impingement, we're talking about pain that's typically located right on the front of the shoulder here. And when it's going to be flared up the most or exacerbated the most is going to be an overhead motion. So typically up through here, or if we're going out to the side, the patient is going to complain of pain. One of the very first things that I'm going to look at is actually I'm going to have the patient raise their arm just like this. So I'll have Stefan go ahead and do that and raise it up. And it's usually about 60 degrees to 120 degrees that you're actually going to start to feel that pain develop. And then once we get past 120 degrees up and through this range, the pain typically actually decreases. This is a very common presentation with this subacromial impingement. The next test that I'm going to go through when I'm taking a patient through an examination is we're going to come across and we're going to internally rotate the shoulder. If this creates pain on that same local spot, this is pretty indicative that we're dealing with a subacromial impingement. So one thing that I want to show you is when we have a problem with the scapula, we can develop pains in different spots. And that's exactly what's going on here. Because subacromial impingement isn't actually a true anatomical diagnosis. We're talking more about a functional diagnosis. So we tend to see that if the scapula sits right here, it tends to wing out a little bit. And so when we're moving the shoulder, there's something called scapular dyskinesis, which is a fancy way of saying that the scapula doesn't move the way that we want it to. And so when we're moving either in abduction here or in flexion, we're going to see that the scapula is going to wing out and it's actually going to impinge on the tendon on the front. So the scapula comes through here, there's a bone here that will actually pinch on the tendon, and that's what's causing the pain. So the question is, how do we fix it? So if we've determined that there is truly pain here, one of the things we want to see during our exam is I'm going to have Stefan go through forward flexion. There would typically be pain during that range of motion. So what I'm going to do is I'm going to actually stabilize the shoulder blade or the scapula and go ahead and do it again. And that should relieve the pain. If that does in fact relieve the pain, it's very indicative that we're dealing with subacromial impingement, because what I've done is I've stabilized the scapula, it's no longer rocked forward in the motion, and it's no longer pinching, and that's that impingement syndrome. So we need to make some changes on this. We're going to use something called active release technique, which is a muscle release technique to help treat some of the musculature around the scapula. And this is a very beneficial tool. And so I'll show you one of the releases we tend to do. So I'll have Stefan lay on his back here. One of the muscles that we want to release and is very typically hypertonic or tight when we're doing these, when we're going through these tests is called the subscapularis. We actually go through the armpit here. We'll pin down that muscle and we're going to lengthen that muscle under tension. And when we're doing that, we're actually going to help release that muscle and decrease that tone and help the scapula move properly. So this is a very common release technique that we'll actually implement when a patient has this impingement. We may also release the pecs because the pecs will rock this shoulder forward and pull the scapula forward. The way that we do that is just holding the arm here. We're going to release it backwards just like this. And this way we're treating pec minor, a very common tight muscle in this functional diagnosis. Finally, I'm going to have Stefan sit back up for me, and we're going to use a Groston tool. A Groston tool has a beveled edge, and it's actually used to help break up some adhesions, create a bit of local inflammation, and so we'll find right over the tendon that might be impinged. It's coming through here, and if you can see here, we would just treat through that muscle tissue, just like this. You'll create a little bit of redness, which is normal. This can help release that muscle and offer a little bit of immediate relief for the patient because it actually desensitizes the area. So we're going to treat the muscles behind. We may also treat in the front where the actual pain point is. These are some of the manual therapy treatments that we're going to use when we're treating this diagnosis. We're going to talk a little bit about some exercises that you can do at home, but also that we'll do here in office to help actually not only relieve the pain, but fix this problem for good so that it doesn't keep returning and become a chronic issue. So as we talked about earlier, subacromial impingement is a functional diagnosis, which basically means that there's not necessarily a torn rotator cuff or any of the muscles are truly injured, but rather the way that your body moves is causing injury or pain when you're moving. So this here is your right scapula. It would sit on the back of your shoulder just like this for reference. What we can see if this is your humerus or your arm bone, when we actually move it up like this, if the shoulder blade is rocked forward, the gap right in here actually will be narrowed down. And this muscle, it's called your supraspinatus, can actually get pinched by that bone rocking forward. So now that we understand that everything to do with subacromial impingement is how your scapula moves, let's talk about how we can improve that to help avoid these types of exacerbations of your symptoms. So the very first thing that we need to talk about is how to control your scapula, how to regain motor control. The way that I like to teach this is I have patients put one hand on the wall, and you can do this at home, and this is a great starting point, and just learn how to lift your scapula up. This one should be easy for most people. Down, pinching it right down, and then retracted and protracted. These should be easy. We should all be able to do them. Up, down, retracted, protracted. They're called scapular clocks. We need to first learn how to move the scapula before we can even start loading it, training it, and creating the strength that we want. So if we look back at this model here, we have to understand that the scapula floats. It's basically attached by 17 different muscles that hold it in place. Your traps up here, they are attached to the top, and then you have lower parts of it, of the trap that attach down on the bottom. And those lower muscles actually pull it down and are very typically weak. So that's really what we want to work on. We focus a lot on releasing the muscles at the top. That's what we saw in the room. But now we want to strengthen the muscles that pull the shoulder blade downwards. One of my favorite exercises is this banded exercise here. We want to make sure that the elbows are tucked in directly underneath our wrists. Most common mistake is that they'll come out. And what that means is that your shoulder blades aren't set. When we pull them in, you can look at my shoulder blades, you can see that they're going to be closer pinched together and they're going to be pulled downwards. And this is the position that we want to hold it in. We can hold this exercise for 30 seconds. You'll feel a good burn in your mid-back, and that's really what we're going for. We can expand it to go up and down or side to side, depending at your level that you're at. But as a beginner exercise, holding it right here in parallel is going to be your best bet. I guarantee just holding it like this for 30 seconds will create enough of a burn and enough of an activation of those muscles that you'll actually start to build the muscles that hold the shoulder blade down like that. So if you're at home dealing with subacromial impingement or that pinching sensation on the front of your shoulder, first work on controlling it up, down, retracted, protracted on the wall, and then start to think about actually learning how to control it by using a band or something like that, just like we showed here. So if you're dealing with shoulder pain, specifically on the front, but any kind of shoulder pain, give us a call at 561-997-8898. We'll take you through a full evaluation. We'll determine exactly what's going on with the shoulder. It doesn't matter if it's a rotator cuff injury or, like we discussed today, subacromial impingement. We're here to help. We're here to get you the right care and the right treatment that you need.